Okay, welcome everyone to our webinar. My name is Jill Johnson and I am the Executive Director for the International Society for Quality of Life Studies. We are very pleased to have you all join us today at this free webinar, Good Data for Good Decisions about Community Revitalization. And before we get started, just a few reminders. This is going to be recorded. We do ask that you keep yourselves muted for the duration of the presentation, as well as your video off to preserve bandwidth. At the end, we will actually have a time for question and answers. You're welcome to turn on your video and unmute yourself and just engage in dialogue at the end of the presentation, but during it, please make sure that you keep everything off to preserve that bandwidth and to not distract our presenters. Just a reminder that you do have the option of also writing comments or questions in the chat bar. So if you take your cursor down to the very bottom taskbar, you'll see a chat bubble. Feel free to click on that and I'll just send a little message so everyone can see. Feel free to write that in and the presenters have access to that as well. And so we can address that at the end of our webinar of a presentation. So with that, it's my pleasure to introduce our speakers. Again, this is Good Data for Good Decisions about Community Revitalization. We have Eli Colton, who is a student at Purdue University, Dr. Jason Ware, who's a clinical professor at Purdue University in the Honors College as well, right? And Dr. Ware has been a part of ISQOLS for a while and has attended several different conferences in the past. And this past year, in 2021, for our virtual conference, we had Eli and Dr. Ware present a poster, visualization poster, excuse me, at our conference, and they actually won an award. So we were very pleased that they're able to present that poster in this webinar. If anyone has any questions, let me know. Otherwise, we'll go ahead and turn it over to our two presenters, Dr. Ware and Eli Colton.
Thank you very much for that introduction. So as Jill said, my name is Eli Colton, and I'll be running the presentation today, as well as I have Dr. Jason Ware here today, who has helped me through all this research and will be adding in some extra descriptions to what I'm presenting, adding in some other background to it as well. So a little bit of introduction about myself. My name is Eli Colton. I'm currently a student at Purdue University, and what really got me interested and involved with this research was seeing what Dr. Ware was able to be doing, looking at community indicators, looking at quality of life, and understanding how I myself could be applying my background to it. So my background is more in the computer science side, as well as data science and economics. And what I really like to try and do with that is figure out how I can combine those three things together to really think about how human decisions impact the outcomes on humans' lives. So try and understand the data side of that, which is what I'll be presenting to you all today, how we've been able to use data to really understand quality of life and what can be done to improve it in the city of Lafayette, Indiana. I'll let Dr. Ware introduce himself if you'd like to. If not, I'll jump into the presentation.
Thank you, Eli, and thank you, Jill, and thank you to everybody for participating. As both Jill and Eli have mentioned, my name is Jason Ware, and I am faculty in the Purdue University Honors College. And I will definitely have to give a big shout out to our dean, Dr. Rhonda Phillips, who I know you're all familiar with, for really introducing me to the world of quality of life studies and community well-being. I am very pleased to be doing this work, and I am both grateful and very proud of Eli for the work that he has been doing with me, and I'm just going to turn it back to him and let him chat about what he's done.
All right, perfect, thank you. So we can jump into it now. So the agenda for today, going to be covering the whole round of the research process, going from the background of Lafayette and everything about the research to some definitions and motivation, then moving on to the methods and results and conclusions, followed by the impacts and future work of what has been done with this. So the background on the research is what exactly we were doing over the past 2 years for this. So before the COVID-19 pandemic, there was a lot of qualitative research being done by Dr. Ware's research group and by others on community well-being in Lafayette, Indiana. So that was more focused on in-person observations, going to community or town hall meetings, interacting with the residents to really understand what's going on with the feet on the ground in Lafayette. But due to the restrictive nature of COVID-19, due to all the regulations set in place on research, on going in person to do things with research through university, things like that, the research really pivoted to more of a virtual setting. And the way in which we were able to do that in our group was pivoting to mining large publicly accessible and proprietary data sets. So really trying to use data science and computer science to understand and further dive into well-being in Lafayette. So our focus here then was a quantitative approach to community well-being and seeing how that would fulfill the City of Lafayette's need for data to inform their decision-making related to neighborhood revitalization, affordable housing, and homelessness intervention. So right now, the city, other than COVID-19 and anything related to that, the city's most pressing need is to stabilize transiency among low-income residents. So that's what the focus of my research was on, seeing how data could be used to understand transiency of residents, specifically in a few neighborhoods in Lafayette. So Lafayette is in Indiana. We are in the Midwest of the United States, and we're in the central, a little bit to the north area of Indiana. A little bit more about Lafayette is that we will be focusing on northern neighborhoods in Lafayette. So our university, Purdue University, is based in West Lafayette, which is in the west side, to the west of the city. And then in Lafayette itself, we are focused on some of the northern neighborhoods in this area. So those northern neighborhoods have a population of around 12,000 people, and the entire city of Lafayette has a population of about 72,000 people. And we're focusing specifically in this study on those northern neighborhoods, as whenever we're looking at them, we really see a unique distribution population. So we can see on the left side of the town here, there is a river, as well as next to the river, there is a railroad. That railroad is called the Monon Railroad. And up until around the 80s, the early 80s, a lot of the people in the North End neighborhoods lived working with the railroad, on the railroad, or with jobs related to the railroad. But after it stopped being used, or the company which employed a lot of these people in this area was sold, a lot of the people lost their jobs. And what we see here is that there's a lot of people who are older homeowners in that area, this aging demographic, as well as there are a lot of younger people who have moved in now that the railroad people have moved out. And these younger people are often living there as more transient residents. It's a very low income renting area. So we see two main groups of people there. We see a lot of older people who have lived there since the railroad times, as well as we see a lot of newer people who are these lower income renters. We do see some some newer owners as well, but the main two groups which we're seeing are these renters and owners. So to try and understand that further, to see what this transient residency has done, I'm going to define two terms that we'll be using throughout this research to try and define what exactly we're looking at. The first thing which we're looking at is livability, and our definition for that is the livability of the environment is the extent to which there are opportunities within the community and or neighborhoods that help residents live a good life. So specifically for that, we're going to be trying to understand what exactly is it about someone's quality that makes them understand that there is livability in their neighborhood, that makes them want to stay in their neighborhood. We'll also be looking at what is a good life, and that is subjectively evaluated. And it's looking at specific groups and individuals to see what makes them more likely to move into a neighborhood and stay. And that's looking to see if the community is perceived as livable and if they have a strong sense of community well-being. In our understanding, our background for this research, what is really pinned upon is that if someone is a transient resident, they aren't going to be there to build community. If they're moving in to rent and then to leave, that isn't going to help them connect to the older community of owners from the railroad times, as well as some of the newer owners. So if we're able to understand this, we're able to see what will make people want to stay in these areas, then a sense of community and then the livability of the area should be able to be increased. And that's what the City of Lafayette wants us to look at. So because of this large number of transient residents in these northern neighborhoods, the community has not been able to grow as much. So the City of Lafayette really wants to increase livability through a focus on neighborhood revitalization and affordable housing. And that's what this research is focused on, using all of this data to understand how exactly different factors about residents relate to this retention of residents. So a little bit of statistics to help present the picture a little bit more about these selected northern neighborhoods versus the rest of Lafayette. So we're seeing here that the median household income is less than half of the rest of Lafayette. So under $20,000 compared to $45,000 for Lafayette. And under $20,000 puts them puts a lot of different residents in this area under the poverty line for the county. The second thing is the median home value, which is again around half in Lafayette versus these selected neighborhoods. So what we see here is that there's a large difference in the values. That could be because of the property, that could be because people aren't maintaining their homes as well. There's a lot of different factors which go into it. So we want to look at those two things to see, do they have an effect on seeing if people stay in the neighborhood? The last thing which we're looking at is home ownership percent. So this one is actually pretty similar in these selected neighborhoods in Lafayette, but we're going to see in the future that home ownership is a very important thing in keeping people tied to their community and keeping them building this neighborhood. So that's another thing which we'll be looking at in the future. And there's a little bit of a difference there, a little bit lower in these selected neighborhoods versus the rest of Lafayette. So the focus of what I'll be talking about today is a few main questions. The first question is, what factors influence the retention of residents in these northern neighborhoods? The second is, what insights and trends do geographical distributions of different household attributes provide? So that first question will be answered a lot through quantitative analysis, a lot through looking at what the numbers are saying. And then the second question will be answered through a more visual analysis of seeing, okay, when we take those numbers and we put them onto paper, we plot them, what exactly does that show? What trends does that show in these northern neighborhoods of Lafayette? And some broad conclusions that we'll be making are how different geographical areas can be found with common factors that correlate with the trend of lower resident retention. So what we're really able to see is that through understanding the data, understanding the background, and then applying that to a more visual application of the data, we're able to determine some trends which align with what the city wants to see, looking at resident retention or quality of life as a whole. So the first method, as I mentioned before, that I'll be using is this quantitative analysis, looking at different attributes of over 2,400 Lafayette households in the northern neighborhoods. And that's all focused on the relationship to resident retention. Specifically here, what we'll be using to determine resident retention is the years in home variable. So our data set is a lot of data, which is proprietary, including household data on these neighborhoods, as well as public data, including census data. So the main proprietary data set which we have, which includes these 2,400 homes, includes a lot of data on specific households. And some of the ones here which we focused on, which through a lot of exploratory data analysis, through looking at correlations, through looking at trends, were found to be important, as well as looking at the more theoretical side. These 6 things were thought to be important in understanding what leads to people's quality of life, what leads to them building a community, as well as them living for longer in their home. So the 6 variables which we chose to focus on as the independent variables related to years in home were age, home value, children, marital status, ownership, and income. So this years in home variable is the proxy variable to determine resident retention, to determine how long someone has been living in their home or renting their home. And then the other 6 things which we're looking at, age, that one's pretty self-explanatory. We're looking at how old the lead member or the members of the household are. We're looking at home values, and that has also been done looking at mortgage data. So looking at a few different things to understand what exactly is the value of the homes in the area, as well as children. The main focus here will be if there are children living in the home. That is looking at if there is 1 child, 0 children, 2, 3, 4, that broad range. But the main focus here will be that determination of if there are children or if they're not children, since that's found to be a kind of dividing line in that data. The second thing is, or the fourth thing is marital status. So we're looking here if the people who are owning this house, living this home, are married or not married. That has a large impact on this years in home, as well as home ownership. So if someone is owning their home or if they're renting their home, as well as income, which is another pretty explanatory variable. That's the household income of all of the residents living in this home. So this survey data is what we'll be using to analyze to try and determine resident retention. The limitations of this study, or at least this first method of looking at the data for these different attributes, is that this data is purely quantitative. Qualitative research in this area has been gathered about resident experiences through a lot of visiting of town halls, talking with people, interviews, but that is not included in this method's results. So this method results are purely focused on what does the data say? Because so much research has been done in the past. Of course, there's more to do about what the people say, but we're interested here in understanding the perspective of the data and seeing how that aligns with the more qualitative side of what the people are saying is the issues. So those different qualitative ideas will be included in the conclusions, but in the specific results of what we're looking at, it's purely showing what the data is telling us. The second thing is that this study is mainly using bulk directory data, which is a lot of data on households, mainly those variables which I mentioned before, plus a few others, as well as the US Census Bureau data. So all this data is from pre-COVID times. So any impact of COVID is not measured. This is looking at the longer term trends or what the city might return to after COVID-19 ends, rather than seeing the most up-to-date data, which we do not have about people's statuses of renting, owning, that sort of thing. So moving into the first results, I'll start off with some more broad results. So here we're looking at years in home, which will usually be on this y-axis. And the first thing which we're visualizing is the relationship to age and home value. The first one is expected. So we're looking at the years in home versus age ranges. What we see here is that a lot of people who are older will live in their home for longer. And that lines up with the trend before, which we were seeing about this Monon Railroad neighborhood. So we're seeing that a lot of people, the older people, are owning their homes. And this trend shows that it's really important to see that there is an increasing trend of people living in their home. So the older people are living in their home for longer, they're not moving away. So there is an opportunity to build community. But what we're starting to see here is that those who are younger, the amount of time which they're living in their home is a little bit lower proportionally compared to those who are older. And that really speaks to the purpose of the study, trying to understand what can be done to make those who are lower in this age range, younger people, want to live in their home for more. Second thing which we're looking at is home value. So this one is really surprising to me. Average years in home versus home value doesn't really seem to make that large of a difference in looking at resident retention. We're seeing here that across all these different ranges, these different box plots looking at the distribution of home value, it's really pretty similar, the amount of years in home for the home value. And this could be, if you think that this could be due to income or this could be due to age or different variables like that, this visualization, although it is only presenting based on years in home and home value, when all these other values are held constant, we do see similar trends across different age groups, across different income groups. So it's really interesting to see that the home value doesn't provide too much of an insight into resident retention. Although in later conclusions, we'll be using home value as an understanding of what the City of Lafayette can be using as a proxy to understand where they can help improve. So although this might not relate directly to retention, it may relate more to well-being as a whole. So we'll be continuing to look at this in the future, even though it might not so directly relate to years in home. The second thing, which is really important and is really insightful, is looking at this average years in home versus number of children. The main definition or the main division here, as I mentioned before, is looking at number of children, 1 to infinity, really. Well, we really start to see max out at 5, but from any children versus no children. So whenever there's no children versus any children, we start to see a large difference. So households with children have lived in their homes for around 6 more years on average. So that's 16 years to 10 years related to those who don't have any children living in their home. And this, of course, could be, when we're looking at this overall broad scale, this could be due to age groups. So older people who've been living in their homes for longer, of course, they are more likely to have children, or those who have higher income. But what we start to see here is that a similar trend is held across all different age groups. So we see that even if it's younger people in their 20s who have children, they're more likely to be living in their home for longer than those who have no children. So although we can't really just go and say to the city, hey, you need to start forcing people to have more children, it's important to think about this, because if the city is making their new developments more accessible to those who have children, or to those who might want to have children, or if they want to focus on a strong schooling system, this can all be helpful in promoting people who have children to want to stay and build that community, rather than only renting and moving out once they are in a different position in life. So looking at children, we do start to see a significant trend that having children in the household leads to people living in their homes for a longer period of time. The next result, which I'll be looking at, is marital status. This one is another very important one, looking at across all different age ranges here, married couples versus single couples. So this one I did break down into different age ranges to make it more visible, to make it more understandable, the trend across all different age groups of seeing how those who are married are living in their home for longer than those who are single. So in the red here on the left side of all these different age ranges, we see the distribution of years in a home for married people, married households. And on the right side, we see the distribution for those, the blue one, for those who are single, for the people who live in the homes that are single, not married. And what we start to see here is that married households have lived in their home for a lot longer on average, specifically 11 years more on average, around 20 years compared to 9 years. And as we see here in this visualization, a similar trend holds true across all these different age groups. So what this is really saying is if the city wants to understand another type of person who they need to make sure that they're appealing to, or that needs to make sure that they're accommodating to, if they focus on making sure that those who are married are able to have everything they need to live in the neighborhood to increase that livability, they'll start to see them live there for longer. So looking at children, looking at marital status, is really about what can the city do to make these areas livable for those groups of people, and that will help with those groups of people living in these areas for longer. The next one is ownership status. This one is perhaps the largest difference. It's looking at homeowners versus renters. And this one is what we expect. Homeowners have lived in their home for 13 more years on average than renters, around 18 years versus 5 years. And a similar trend also holds across age groups. So we see if someone is 25 and they own their home, they are more likely to have lived there for longer than a renter who's 25 years old. Or if they're 60 and owning their home, they're more likely to live there for longer than a renter. So this really shows is that if ownership of homes is promoted, if there's more development, which is for homeowners rather than renters, if we make sure that there's the resources in place for homeowners, if different organizations can come in and help provide those resources, then what we can see here is that community can be built from homeowners who will be staying for a longer period of time rather than renters who might be moving out faster. So it's all about looking at what can be done in these northern neighborhoods to make it more appealing to homeowners, to make it so that they feel like they can live and be accepted in this area. The last thing which we're looking at is household income. So we see here a lot of different household income ranges. As mentioned before, under $20,000 is the median, around where the median income sits. So that's why we're seeing a lot of outliers here in the upper side of it. Really a lot of outliers in a lot of these, since we're looking at 2,500 homes. So we see a lot of different household incomes, but under $20,000 compared to all these other different income ranges, specifically looking at incomes greater than 50,000, we see that those who have incomes of greater than 50,000 have lived in their homes for 13 more years on average compared to households with an income of under $20,000. So that is 23 years compared to 10 years. That overall value is, of course, affected by the age a little bit, since we start to see the residents who are in the 30-year range to 40 years old range live in their homes for longer than those in the 20-year range who might not have as much money. But when we look at these trends, even at that age level, what we see is those with a higher income will live in their home for longer. So now that these main trends have been understood, we can use them to try and visualize the impacts on distribution geographically. This moves into the second method, which is visually analyzing these geographic distributions of household attributes of Lafayette to determine trends. A little bit more about what we're looking at here. I presented this visual before of the northern neighborhoods, but specifically we're focusing on 4 different census tracts. The first one, which is including the Monon neighborhood and St. Louis McAllister neighborhood. The second one, the same 2 neighborhoods. The third one is the Hannah and Vinton neighborhoods. And then the last one is the St. Louis McAllister, as well as the Lincoln and Historic Jefferson neighborhoods. So we're going to be, how we're going to be using this methodology is we're going to be plotting each individual household, and then we're going to be looking at ones which tick certain boxes, so which fall into certain trends. The first one which we'll be looking at is home value and income. So I mentioned before that income is a very significant result in looking at how long someone will be living in their homes, while home value is a little bit less of a significant result, perhaps not even at all. But the reason why I've included it here is to help show where the city can intervene the most. So where would benefit most from city intervention? Since it's easiest to bring someone's home value, or to look at someone's home value who's in this lower range and bring it up a significant amount when that home value is lower compared to when it's higher. So in this graphic specifically, we're focusing on incomes less than $20,000 and home values less than $75,000. And those have been plotted in red on top of these gray values, which are all the other households. In that situation, it is incomes greater than $20,000 and home values greater than $75,000. So by looking at these low income and low home value areas, we can see where might be benefited most from city intervention. What we start to see here is a lot of trends in these northern neighborhoods. When we look at those for income and home value, there's a lot of red dots there, which means that there's a lot of places clustered at low income and low home value. And when we look a little bit deeper into this, looking at more at a lower or at the same income of less than $20,000, but at a lower home value of less than $50,000, we start to see more trends appear. So these are the lowest home values, the lowest incomes in this whole study. And we start to see that there are streets or patches of geographic area where they are most likely to be populated. So here I've highlighted in yellow 2 circles, which start to show, like in the left circle, different streets which have a lot of these homes in them, or in the right one, a larger area which has a lot of these homes in it. And so what the city can do here is, if they're looking for a more targeted intervention of what can be done, these specific areas, these homes can be researched further using a little bit more qualitative results to understand what can be done to improve the quality of life, the living there. Since looking at these trends, if we even look at it a little bit further, this one is including the renter status. So as we said before, those who are renting are more likely to be transient residents. So once we include that, we even see these trends hold true. And these households would be considered very high at risk for low resident retention. And that's looking at this very low income as well as renter status. So if the city wanted to understand more about this issue, about where they can focus on, they could use results like this to say, okay, here's a street, or okay, here's a patch of ground, a patch of houses that we should be looking at to understand these trends further. So this one is looking at a little bit different data. If you remember before, a lot of data in the north end was highlighted in red, while now a lot of data in the south side is highlighted in red, because this one is looking at what the data was showing as high risk of low retention. This one is focused on unmarried, no children, renters, age less than 30, and income less than $20,000. This one is no longer including this home value, because what we start to see is a lot of those neighborhoods in the southern side might have a larger home value, but a lower rate of retention. And that really influences those results which we were seeing before of home value not having as much of a significant impact. And that could really be because of these southern neighborhoods, which are more focused on these Lincoln and St. Louis McAllister neighborhoods, as I mentioned before. So that is, so whenever we're looking at these red dots, that is understanding from the data what is high risk. So this is purely seeing these trends, this location trends. And the interesting part about this is this really aligns with what the city is doing with their current initiatives. So I mentioned before that this is the Lincoln neighborhood and the St. Louis McAllister neighborhood. And the city's main focuses right now are what can be done to improve quality of life, to be improving livability in these specific areas. So Dr. Ware's research group, as well as Lafayette, are doing different studies, are doing a lot of analysis in these areas to understand these trends further. But what this data shows is it kind of backs up what the city is doing. So it shows the viability of scaling this up to larger sizes, the viability of seeing, okay, we can use this data-driven research to understand where these areas are instead of the current way which the city is doing. So the way which the city is doing right now to understand this is very labor intensive, while if a system like this was set up where this data could be analyzed to determine these trends, it's a lot less burdensome to determine areas which are at high risk of low retention, which could be improved by the city. And it also might provide some new trends, like if the city wasn't looking at this yellow circle highlighted above, which we noted from our other visualizations could be at high risk of low retention. If the city's main focus was on these southern neighborhoods, they might not be thinking about patches highlighted in yellow or different groups spread out through the city. So what we were able to do with this then is present it to the city of Lafayette and say, here is how the data is able to back up your findings, and here's how you can use the data to further what you're doing in the city, to further this building of livability. So some of the broader conclusions of this data is that certain locations in Lafayette have congregations of households with attributes that commonly correlate or commonly predict low resident retention. And as I mentioned before, those are income, having children in the home, ages, ownership status, as well as marital status. And I have that in the right box. And then if we're looking at scalability, how this could be applied to not just Lafayette, but other large cities or medium-sized cities, is that using this combination of quantitative data analysis, as well as looking at a geographical mapping of significant results, really can provide data-driven results similar to what the City of Lafayette has produced right now. So it allows for a different alternative avenue of seeing where these issues are in Lafayette. And how, now that we've presented this to Lafayette, shown them what can be done with it, here's how they've been able to use it to improve their different ways of moving forward their community planning. So right now, what they've been able to do is use this to inform their decisions on neighborhood revitalization, specifically with the proposing of development of church-owned land. So right now, this church-owned land is owned by a church in Lafayette. There's a lot of land in these northern neighborhoods, which could be used to develop low-income homes or different homes to allow more people to move into this area. So these owners of the church are a little bit hesitant to sell this land because they're worried about people with children moving in, low-income children moving in, and causing issues for the church, perhaps issues of vandalization, issues of making livability more difficult in the area. But what the City of Lafayette is able to do with this data is show that, no, it's actually the opposite. If we're looking at the data across all these different age groups, across all these different trends, what we see here is that those with children are actually increasing the livability of the neighborhoods. They're increasing the amount of time which people live in these areas, which people live in their homes. So by understanding what the data has to say, the City of Lafayette can take this to this church who is very hesitant about selling their land and show a data-driven approach of how selling this land would be beneficial to moving forwards to moving forwards and improving the livability of this area. And that has really opened talks. It's really allowed for more in-depth planning of what can be done for selling this land to families and homeowners. So next I'm going to allow Dr. Ware to speak a little bit about these impacts, about how this has impacted the City of Lafayette, as well as research done to the City of Lafayette.
Thank you, Eli, and great job. I'll just sort of echo some of what Eli just said in terms of the immediate impacts that the research is having on the City of Lafayette. And so what Eli referenced in terms of the church-owned land is there is on the border between the Lincoln neighborhood and the Hannah neighborhood, which Eli mentioned, there was a hospital. And so there's a Catholic hospital that purchased a bunch of land in the late 70s, early 80s, around the time when the Monon shops closed, when the train shop closed. And well, that hospital, which has a chapel connected to it, has been torn down, but the chapel remains. And so there's a lot of land now in that area. And the city sees that land as an opportunity to do some redevelopment and to incorporate some mixed housing. So some all focused on affordable housing. So different, so multifamily places, but also single family places. And as Eli mentioned, the church was very resistant to that. But what this data is showing is that, yes, the households that have children are more stable in terms of staying in and being retained within a neighborhood, and that these homes that contain, that have children, they aren't, I guess you could say, representing some of the other types of characteristics that you might see in some of the other homes in the neighborhood that are, that consist of very, very transient people. So there's more stability, but there's also less, I guess you could say, you don't see some of the negative attributes that you have seen in some of the other transient homes. And so we are partnering with Habitat for Humanity locally, and working with the city and Habitat for Humanity are moving into that neighborhood next to the church and are focusing on neighborhood revitalization and incorporating this data. And so this data has been very helpful in making those types of decisions. And in addition to that kind of, I guess when I say that kind of, in addition to the city being able to take this data and use it as sort of a negotiation tool, as it were, this Eli's project has also then informed several other quantitative projects that we're working on with the city, because as Eli mentioned, the cities, and this is per the city, per our contact with the city, their number one challenge right now, besides keeping people housed in the midst of this pandemic, is this problem of transiency in the North End. And so the studies that we are working on right now come directly from the expressed needs of the city to figure out where issues prevail in the North End of Lafayette related to affordable housing. So we have a significant affordable housing study going on. We're also doing very specific livability studies in some of their target neighborhoods where the city is planning they are in the midst of strategically planning for redevelopment in some of these neighborhoods. So we're doing livability studies. We are also, again, in partnership with Habitat for Humanity, doing a Habitat for Humanity impact project to get an understanding of what it is about the Habitat for Humanity house build process that really enhances multiple domains of well-being for the residents who have gone through this process, and where those pockets of potential exist within the North End for working with these families and in their neighborhoods to increase, to focus on neighborhood revitalization. So there are just a number of other projects that this project that Eli has just articulated have informed and have inspired, and that we're in the midst of doing to further understand what the data suggests can be helpful for the city to focus on. And as Eli mentioned, we haven't abandoned all of the qualitative work. It's just been somewhat on hold because of our access issues. I will say that we are still in the midst of conducting interviews with some folks just via the telephone, which is still good. There's still great qualitative data that's coming from that. It's just that we do prefer to interact with residents in their neighborhoods. But so those are some of the primary impacts that this project has influenced.
Thank you, Dr. Ware, for providing that insight. So as Dr. Ware mentioned, there's been a lot of different impacts on the city, and one of the ones which the future work that the group is doing is seeing how this quantitative analysis can further the City of Lafayette's goals to improve well-being, and that is through automating community indicator data processing. So as I mentioned before, a lot of this work is through data which is from the city, which is looking at a lot of different facets of the city's quality of life. So one of the ways which Dr. Ware's research group is able to do a little bit more of a qualitative and quantitative analysis of the quality of life is by going through the different neighborhoods, by taking note of a lot of different things on different households or different houses. Like, for example, walking down one street and visually analyzing all these houses to say, how is this roof condition, and rating it on a 1 through 5 scale of poor to great, and then going through and doing this for a whole lot of other things like the sidewalks, the siding of the houses, just getting a qualitative idea of understanding how these neighborhoods are doing for their property conditions. So what I'm currently working on with a few other people is seeing how this can be done, how this data can be analyzed in an automated fashion and allow for a data dashboard or something very transparent to be provided to the city so that all of the residents can understand how their community is doing, how they're doing at meeting community indicators, and that sort of idea. So this is done through a map visualization. We can see here on this bottom left side, the start to this visualization. It's in a very bare bones stage right now, but this is a plot of the map. And what we can see here is if you, for example, highlight over a household and want to understand how this household has been rated, we can see all these different condition ratings, like the roof, the gutters, the windows, and this has been done for a lot of different households in the area. And then what we want to do with that is aggregate that data on a larger scale, not just looking at these property conditions, but also tying in some of the data which I've done, which I've looked at, looking at these household data characteristics, as well as looking at things like evictions, looking at homelessness data, incorporating all these things together to make a visual data dashboard so that the community can see specific locations which could be prime for improvement. And this allows for a more open dialogue for the community to understand what indicators are being looked at, as well as for the city to have an up-to-date way of tracking how they're doing over time. And as well as having that, it's a very less labor intensive process after it's put into place. Because right now the city has a lot of data which they still need to look at, not enough people to look at it. And this takes off that burden of having to every 6 months, every year, take a look at this data, see how it applies to the community indicators, update these values. What this system would hopefully do is make it so that all happens at a click of a button, or the upload of data, or something very simple to allow for continuously understanding how the City of Lafayette doing. So that is how this work has influenced my future work. It's really diving into some more analysis of different variables and seeing how those relate to retention and well-being as a whole in Lafayette. So that has been this whole presentation on how I've been able to, how Dr. Weir's research group has been able to use this data-driven analysis to understand resident retention, to understand community well-being as a whole in the City of Lafayette. So I'd like to thank you all for listening and watching, and thank you to ISQOLS for setting this up. And now I'd like to either let Jill speak or open the floor up to questions.
Wonderful. Thank you so much, Eli and Dr. Ware, for that great presentation. Really insightful information. If anyone has any questions, now is the time. So feel free, you can write your question in the chat bar down below, or feel free to also raise your hand. You can do that just by clicking on your own profile and raising your hand. We'll go ahead and address those. Anyone have any questions or comments? While we're waiting, I have a question for Dr. Ware. I know that you took our community indicators certificate program with Dr. Sergi, and wondering how that might have impacted this study at all. You're muted. Sorry, Dr. Jason.
Oh, sorry. Well,
Yeah.
confession, I haven't finished that.
Oh, okay.
Yes. But what I have done, it's a pretty amazing thing. To be quite honest, I don't know how many people have completed it, but I'm thinking it's pretty amazing, like that whole certificate program. So I'm thinking, shouldn't everybody who does this kind of work do the certificate? Like it's it's pretty awesome. Yeah, I saw that Dr. Sergi was on here, so I was nervous. I was like, oh no, I haven't completed that yet.
Well, just some extra motivation to complete it then.
That's right. That's right.
And I was also wondering if, the fact that Lafayette is home to Purdue University, is there any correlation with, you mentioned that there's high transiency with student ranges or age ranges below age of 25. Are some of these individuals renting because they're college students? Does that have any impact?
I'll jump in here real quick, Eli. So most of the Purdue students live in West Lafayette. Now there is a significant number of students who do live in Lafayette because the rent is significantly less. And the neighborhoods that Eli mentioned, he has the map up. So this dark area here is the river, and it very physically separates West Lafayette from Lafayette. And so just over the river, just past this dark area here that you see, to the right of it or to the east of it, there are some neighborhoods where Purdue students live. So those would be some of those younger folks who are also making a lot less money, and they may contribute to some of that transiency. But again, most of the Purdue students are living in West Lafayette.
Okay. And has the government, you said you were speaking with the local government agencies, have they given you any sort of metrics for how they are measuring well-being, or as you put it, the good life?
So again, Eli, I'll jump in here, not because you can't answer, but just because. So that's a simple question, but it's a complicated response. So I guess the answer is our local Chamber of Commerce, which is separate from our government, does have a quality of life initiative, and they do have several tenets that they are looking at for measuring a good life. And those things include, they're not typical. They're not the kinds of things that I don't know. I guess I would say like a well-being or quality of life researcher would be looking at. So they are things like they want there to be a good town and gown relationship. So a good connection between the university and the city, which makes sense, town and gown. They want there to be good transportation opportunities to get to some of our bigger towns. So Lafayette is sort of in between Chicago, which is 2 hours to our northwest, and Indianapolis, which is about an hour south. And so they want, the city would values or our Chamber of Commerce values a good, train system that will take us connect us to those places. Things like a good after hours app, things like a good walking corridor. So, I mean, these are important, and they are, I guess, reasonable indicators, if we want to call them that. But the city itself is still trying to develop indicators. And so that's, we didn't really say this in our presentation, but that's a big part of what this data collection and analysis is about, is to help establish some of these indicators, to get a sense both qualitatively and quantitatively what these indicators can be or should be, and then put them in place and then measure them over time, which is in part of that is what the automated piece that Eli mentioned would be about. Is there are some things that we're looking at related to neighborhood revitalization, related to affordable housing, and related to homelessness intervention that we are sort of proposing as some indicators, but obviously not the indicators that can be measured in a somewhat automated way, while we rely on other researchers to do some of the qualitative data collection over time. So long answer. I don't really know that I answered your question, but.
You certainly did, yes. I know that there's a lot of discussion about data-driven community indicators, which, the community indicators is subjective as well, So I like the groundwork that you're all doing, I think is important. And another plug for the Community Indicators Certification Program with Dr. Sergi. So if anyone is interested in this type of work, definitely look into that certification program. Is it Tigran? I see your video is off. Do you have a question?
Yes, actually. Yeah, first of all, thank you very much for the nice presentation. It was really interesting to follow. I'm a postdoctoral researcher in Portugal. And I just joined a project, and we are trying to work with low density areas of Portugal and developing well-being index. And my question is regarding the data. I would like to ask you, how did you collect the data? And did you also conduct interviews or like discussions with the local population in order to see their attitude towards well-being?
Yes. So this data, which we're using, is from a database called the Polk directory. So this Polk directory was not conducted by us, but there were a lot of different surveys, a lot of different research done by this group to understand household data across a lot of areas of the United States, more focused on what can be used for advertising campaigns. So understanding if an advertiser wants to come in and see what a demographic of an area is, they do these surveys so that those groups can better understand the layout of those lands. So we're able to use this data to see a lot of these characteristics about households and use those to drive this research, to use those to see what types of groups are living in these areas, as well as combining that with census data, combining that with other government data like database on home mortgages, to tie those things together and provide different data sources for this research. So this research itself, this more data-driven side, utilizing those different resources, was not focused on the more qualitative piece, on seeing what people's ideas were about their thoughts on livability, about quality of life in the area. Perhaps Dr. Ware could speak more about that, since that's focused on some of his other research. So those sorts of things are being done. Those sorts of, that research is being used to supplement this, to understand these results of saying, okay, why is the area the way it is with, for example, we see high transiency in certain areas, but also high owners in some areas, and that's due to people's, that's due to that separation of older homeowners versus newer renters. So we use those stories to supplement this data, but specifically when trying to understand residency with this lens of building different models, those are not inputted into it.
So yeah, I will I guess respond to the qualitative piece. And yes, we've had multiple conversations, and we will continue to interview residents in the North End neighborhoods of Lafayette. We have focused primarily on the Lincoln neighborhood, which I know means really nothing to most of you watching, but it's one of the I think it's one of the more impoverished neighborhoods in the North End. And so we have, for the last 4 years, really been having a lot of conversations with folks in that neighborhood. And there are a number of themes that emerge from our interviews related to safety as an issue. So a lot of folks in the neighborhood do not feel safe for many reasons. There is a drug problem in the sense that there's a lot of drug selling and dealing in the area. There are a large number of households with children who also live in the neighborhood. There is a neighborhood center, and so a lot of the youth, a lot of the kids 14 and under who are in this neighborhood they walk to this neighborhood center. And so there's also safety issues related to traffic, in the sense that there's a lot of cars who speed through the neighborhood with all of these kids walking around. So there are safety concerns related to drugs. There are safety concerns related to traffic and transportation. There are safety issues related to a lack of lighting and on some of the very long streets in the neighborhood. And so some of this data over time, we always keep the city apprised of whatever our findings are. And so there have been initiatives to address lighting. So there's been a large budget item that the city has approved to increase lighting in the neighborhood. There have been some traffic studies done to see where speed bumps or stop signs need to be. And so my point is, yeah, we're talking to people in the neighborhood, and there are trends related to safety. There are trends related to crime. And also right now, because of the pandemic, there is a transitional housing center that isn't in the Lincoln neighborhood, that's very close. But because of the pandemic, a lot of those folks aren't able to shelter during the day because of quarantines and isolation. So a lot of these folks who are homeless are are now more out on the streets, which has increased more drug trafficking and has increased all kinds of other things. And so people aren't feeling safe in the neighborhood, which translates directly to them not necessarily wanting to stay in the community. And so there's a large list of, I guess you could say, items for the city to address, and the city is addressing some of those. I see that there's a question that says, how did you compare your results, or what state or district you used as control data model? How did we compare the results, or what state or district you used as control data model?
Yeah,
go ahead, Eli.
I can speak about that if we answer Tigran's question fully.
Yes, thank you very much for the question. Perhaps I have the second one, but I see there is a question in the chat. Maybe I can ask it later.
Okay, perfect. So to address the one in the chat about how we compared this data, or what we use as a control. So what I used specifically as a control to this data was understanding some of the results which Lafayette had already done, as well as using these different community interviews, the different understandings of what we already have in these neighborhoods, of what the issues are, comparing them as to what the data shows is the issues. So specifically, like for example, looking at this slide as kind of our control. So Dr. Ware mentioned before that we're looking at the Lincoln neighborhood specifically a lot, or the city is looking at the Lincoln neighborhood a lot for community revitalization. And that is what we're seeing in the south side. The Lincoln neighborhood is down in this bottom yellow circle. So this data, we were able to do, on the data side, we're able to do a lot of quality checks with a few different surveys within the city, as well as census data, to understand that the data which we're looking at was correct and accurate on that side. And then as the control data, what I used as that was some of the other studies in Lafayette, some of their findings, to see how this lines up with how Lafayette is thinking things line up. So because a lot of this is subjective in what community well-being is looking at those, is looking at what the city is saying is community well-being as our model for control, comparing it to what this data, what this data is showing makes a resident at high risk of low retention, and matching those two things up to kind of control, to kind of validate the results of what we're seeing. Does that answer your question?
I'm not sure how to pronounce the name. Imtiaz. You feel free to respond or unmute yourself. We can't hear you. Sorry. If you can unmute.
Okay.
There you go.
Yeah, I got you. Yes, sir. I got your. This is Ali Colton. I got your result as well, and that's most interesting. This good data for good decisions. Actually, my question was different for that. Actually, I am working on quality of life on impact on type 2 diabetes with systemic hypertension. I am working on healthcare impact on quality of life. But this was a very interesting topic I have got. I'm from Asia, India. Actually, I'm working on this. I'm comparing with US data. Actually, I have control group that is in US. I'm working with Professor Sharik Masoodi that is working on Maryland School of Medicine. Thank you so much for giving such a beautiful, interesting presentation. Thank you so much.
Yeah, of course, I'm glad you enjoyed it, and thank you for your comments. I suppose related to that sort of research where you're comparing the data between two different groups, we don't really have any controlled data sets in that sort of way. It was more looking at the qualitative results, or what the City of Lafayette is thinking is important, and that's what we compared to as our control rather than some other data set or some other study which someone else has done.
Interesting.
Great, thank you. Good question. Any other questions or comments?
May I one more? Yes, thanks again. And the question regarding the governance. You have already a good database and you have already just mapped, etc. And I guess this could be very useful for decision-making process. And what is the communication with local authorities or local decision makers? Do you try to reach them, and could they use this data for territorial decision-making process and governance?
So yes. So this whole project comes directly from an expressed need from the City of Lafayette. So from the mayor's office and from our economic development office. And so we are in constant correspondence with the City of Lafayette. And so we share our results with them on a very regular basis. And also, so students in the research group like Eli, but also I teach a well-being course, and we do projects, these types of engagement projects where we're collecting data and analyzing it and packaging it as resources and tools for the city. And we always invite, for example, the mayor is coming to the students' presentation this Monday. And so we always sort of hand them this data packaged and visualized in a way that they can use it. And they are indeed using it to do a couple of things, right? Like, so in the Lincoln neighborhood, for example, they're working on a strategic plan. They use not just this data, but the data that we're able to collect and package for them to inform the decisions they're making as they are making redevelopment plans. This data is also shared with residents who are wanting to do things like start a neighborhood association in their neighborhood. And so we are not doing this research sort of in a bubble. The needs of the city and the residents themselves inform the nature of the work. And so it's our responsibility, as it were, to make sure that they have the data. And so we do partner with them in terms of sharing the data with them and giving it to them.
Thank you very much. That's great.
Great. Thank you, Tigran. So we're approaching 1 hour. So with that, we'll go ahead and end this webinar. I'd like to thank first and foremost our presenters, Eli Colton and Dr. Jason Ware, for this great presentation, excellent work. We look forward to hopefully seeing more work in the future from you all. If you have anything to build upon in the future and like to present again, we would love to have you back. And as well, I would also encourage everyone who's here to consider, if you aren't already a member of ISQOLS, to join us. We'll be offering a free 3-month trial membership to anyone who's not a member. We'll be sending that out in a follow-up email, as well as a link to the recording, which will be located on our membership-only forum. And you have full access to that, as well as a membership discount to our upcoming ISQOLS conference. This year, in August 2022, we'll be hosting our 20th annual conference in Vermont, Burlington, Vermont, the first week of August. So we encourage you, if you have any interest in that, to please consider submitting an abstract. The deadline is coming up soon. It's January 15th. And you can find out more details about that on our website at isqols.org. And we'll be sending more details via that email as well. Thank you, Eli. Thank you, Dr. Jason Ware, again, for your time. Thank you, everyone, for your participation. And with that, I wish you all the best wherever you're tuning in from. Either good evening or have a good day.
Thank you so much, Jill.
Thank you very much.
Thank you all.
Thank you, everyone.
Thank you.
Thanks, Eli. Bye.
Yep, goodbye.